Knee cartilage damage is a common injury. It can cause pain, swelling, stiffness, and other unpleasant symptoms. MACI repairs knee cartilage damage by using your own cartilage cells, called chondrocytes. If you and your doctor decide MACI is right for you, a small sample of cartilage will be taken from your knee during a minimally invasive arthroscopic procedure. The sample is then shipped to Vericel's state-of-the-art FDA-licensed cell processing facility, where it will be frozen. Your cartilage cells will then be placed onto a specialized collagen membrane, becoming the MACI implant that is used in your procedure. The day before your procedure, the MACI implant will be delivered to the operating room. On the day of your procedure, your surgeon will prepare your knee by removing the damaged cartilage. The MACI implant is then shaped to match the defect, then placed and secured. Depending on your defect location and size, your doctor has options for MACI implant delivery. Your doctor may deliver your MACI implant through a mini arthrotomy or through a minimally invasive arthroscopic option. Over time, your cells will grow, repairing your damaged cartilage. Following the MACI procedure, you will begin a physician-prescribed rehabilitation program designed specifically for you. MACI creates a long-term and durable repair tissue, helping you overcome knee pain and resume your active lifestyle.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is made up of your own autologous cells that are expanded and placed onto a film that is implanted into the area of the cartilage damage and absorbed back into your own tissue. MACI is used for the repair of symptomatic cartilage damage of the adult knee. The amount of MACI applied depends on the size of the cartilage damage. The MACI film is trimmed by your surgeon to match the size and shape of the damage, to ensure the damage area is completely covered. Limitations of use. It is not known whether MACI is effective in joints other than the knee. It is not known whether MACI is safe or effective in patients over the age of 55 years. Important safety information. MACI should not be used if you are allergic to antibiotics such as gentamicin or materials that come from cow, pig, or ox, have severe osteoarthritis of the knee, other severe inflammatory conditions, infections or inflammation in the bone joint and other surrounding tissue, or blood clotting conditions, have had knee surgery in the past 6 months, not including surgery for obtaining a cartilage biopsy or a surgical procedure to prepare your knee for a MACI implant, or cannot follow a doctor-prescribed rehabilitation program after your surgery. Consult your doctor if you have cancer in the area of the cartilage biopsy or implant, as the safety of MACI is not known in those cases. Conditions that existed before your surgery, including meniscus tears, joint or ligament instability, or alignment problems, should be evaluated and treated before or at the same time as the MACI implant. MACI is not recommended if you are pregnant. MACI has not been studied in patients younger than 18 or over 55 years of age. Common side effects include joint pain, tendinitis, back pain, joint swelling, and joint effusion. More serious side effects include joint pain, cartilage or meniscus injury, treatment failure, and osteoarthritis. For more information or to view full prescribing information, please go to maci.com.